Anyone going through medicated IUI should be mentally prepared with the following information. The timeline for a medicated IUI cycle will typically mirror a 28 to 30 day cycle, especially if you're taking medications. Even if you have irregular cycles that are normally longer, if you're taking medications, we're trying to make it that regular monthly cycle. You call us with day one. We tell you to come in on day 2 or day 3. I like to do baseline blood work because sometimes you can have an active follicle and you can have a dysregulated cycle where it might not be the right thing to start the medication. And I look for an estrogen level less than 80, which is baseline, a progesterone level less than 1.5 or less than 1. Now, if you're someone who usually gets really irregular cycles, I'm not going to make you wait until you get day 1. I might just bring you in for wear and cycle blood work because a lot of times, especially in cases like PCOS, you might be stalled at day 3 for weeks at a time. Then you typically will come in for a mid-cycle scan. Usually we bring patients in around cycle day 12. It can vary from person to person, but we want to measure if they have an enlarged follicle that looks mature and ready for a trigger shot. We administer a trigger shot, or we can rely on someone to ovulate on their own. I like to be precise with the timing, so I will usually opt for a trigger shot, which is HCG, which is the pregnancy hormone, but it actually mimics the LH surge, and it will lead you to ovulate within roughly 2 days. So once we administer that will then kick off the timing for the IUI, and usually the IUI is scheduled within 24 to 36 hours of the trigger shot. The goal here is to line up sperm and eggs as best as we can. And we know that the egg or eggs, once they're in the fallopian tubes, will last for only 12 to 24 hours, but sperm can last for up to 3 to 5 days. On IUI day, we collect a sample of sperm. It might already be previously frozen if you're using a donor, and we'll thaw it or collect it, wash it, concentrate it. We spin it in a centrifuge and we concentrate it down to a pellet of the healthiest sperm possible. And then we use a syringe attached to a catheter to inject it at the top of the uterus using a speculum exam. Now, this feels like a pap smear. It is usually non-painful. If you're partnered, we're going to say, if you can, try to have sex today and even tomorrow because it may improve your chances. But 2 really important unforeseen circumstances that can arise to be mentally prepared for is that when you come in for your mid-cycle scan, your follicles may not be ready. You might have like a 14 millimeter follicle when we're looking to trigger at 18 to 22 millimeters. And so we might say they typically grow 1 to 2 millimeters once they start growing. Let's bring you in 2 days because you're more likely to be ready then. We could also say that the IUI cycle is canceled for really 2 major reasons. One is an over response. Usually the oral medications we use for most medicated IUI cycles, you're not going to produce that many eggs. And depending on their age and the risk tolerance that you have or that they have, you may say, oh my gosh, you have more than 4 to 5 mature follicles. This is too high risk for twins or even triplets. Let's cancel the cycle. Another reason we might cancel the IUI is if you come in for mid-cycle scan and you've already somehow ovulated. Best thing to do is to just wait till you get your period and then start again. Around 2 weeks after the IUI, my nurses will call you to check in and ask, did you get a period yet? Did you do a home pregnancy test? If it's positive, then we start doing pregnancy monitoring. If it's negative and you get a period, the whole cycle resets again and you can get started with another medicated IUI.